Hi, I'm Victoria Tamberio. I'm a student at Bloomsburg University. I'm currently a dual major in political science and social work. For my presentation, I decided to focus on the global issue regarding the healthcare gap. I chose this to be able to draw awareness to the lack of access and the unfairness revolving healthcare. What is the healthcare gap? The healthcare gap is defined as the difference between recommended best practices and the care that is actually provided. In other words, the healthcare gap is the difference in two groups of people, the people that have healthcare, that have the access, and that have the resources to be given the care that they need, versus the people that do not have healthcare for whatever reason. They may not have the access, they may not be able to receive it, and the healthcare gap looks into those different reasons for the gap in receiving healthcare versus not receiving healthcare. An example of this is a person that is overdue for a needed screening, such as an annual mammogram or colonoscopy or well visit. And all three of those medical exams are things that people should be getting annually, and they are very important to overall health. They are unable to receive this care due to age, poverty, access, and etc. There are multiple different types of reasons that people do not have health care, and those reasons need to be figured out. Multiple people become affected by the healthcare gap. These are three major groups of people that are affected, such as low-income families. So families that are living in poverty, they simply just do not have the money to provide for the overall health of themselves, whether that's not being able to pay for health insurance, not having access to the resources to get the health insurance, just simply there's no money, so there's no way to pay for care that you need. Minority groups. One statistic is that infant mortality for black babies remains nearly 2.5 times higher than white babies. So what that means is a lot of times minority groups are often living in poverty, or they're just not given the same resources as dominant groups. So minority groups are going to overall be more affected. Young adults. Compared with other age groups, young adults are most likely to go without coverage. This reasoning because as a young adult, you simply just don't have the knowledge of how the healthcare system works and what exactly you need. And a lot of times, as a young adult, it's not always the situation, but you're expected that your parents are still just helping you out, but not every young adult has that. So then they don't have the access. Here are some of the major countries with underdeveloped public health. Mali is one of the worser ones. They are one of the poorest nations. They are greatly affected by poverty, malnutrition, and inadequate hygiene and sanitation. Another one is the US, which this was shocking to me being someone that lives in the United States because when you think of the US, you think of them being very developed and very high speed, but in reality, we really do not have much to offer when it comes to healthcare. They rank last on access to healthcare, administrative efficiency, and equity in healthcare outcomes. And there's also no universal healthcare in the United States. The next is Indonesia, and I found this eye-opening statistic that for every 1,000 people, only 0.22% of those people receive healthcare. So that just gives a broader view of how many people are not receiving healthcare in Indonesia. And lastly, Morocco. More statistics that were very shocking was their inadequate number of physicians. So in a group of 1,000 people, only about half of those people are going to be able to meet with a physician or get the access. And then also lack of hospital beds. There's really only one hospital bed versus a group of 1,000 people. Some solutions to the healthcare gap, which may be easier said than done, but it's still important to know that there are solutions. So my main reason for picking this topic is the first solution, which is raising awareness through education, which can help address health equity. And then improving resource coordination, so better communication among healthcare and its people, letting people know how to get the resources, where to get the resources, and what resources they need. Also, advancing scientific knowledge, which is always important because more knowledge comes with more ideas, which comes with better solutions. And then also better funding to provide healthcare and reducing poverty. And lastly, improving the capacity and number of providers in underserved communities. So a lot of communities where people are living in poverty, they don't have the access because there isn't any access to even get, because a lot of times that there's not going to be healthcare providers in underserved communities.